Hello everyone, my name is Anne and you are welcome and welcome back to my channel. Today for a special occasion, yoga for pregnancy according to Dr. Gasquet Method. And I am really happy to have Sophia as a guest here. Sophia is a wonderful yoga teacher, very active in her life before the pregnancy and during the pregnancy. And so, hello Sophia. I want to ask you, what months are you in right now?
Yeah, 8 months and a few days.
Great. And so you are in the third trimester.
Yeah.
Do you feel any major difference and something that is bothering you, maybe giving you some discomfort? And
To be honest, I've been quite lucky. I don't feel major changes in this third trimester. She is placed quite high and she's in reach position, so her head is in my ribs. So that's kind of the only thing that's getting a little bit more painful. It's manageable, but that's probably the one thing I'm feeling the most at the moment in this trimester. Otherwise, everything else is pretty normal and how it's been through the whole pregnancy. So.
Great. So today, according to the Gasquet Method, you know, your posture is, your breath is affected by your posture, So we're going to make space. If we make space, you can breathe properly, and it's also going to make space for your baby, and you are maybe going to feel better. So let's start by sitting on the pillow. So you can place the pillow, yes, maybe we're going to turn to be like, so we can see you. So it's really important here to manage your posture. So the position, your sitting position, to have support for your knees. To have your knees, I suggest maybe to make the pillow higher in the, to move the microbeads. Microbeads, do you say? Yeah, a little bit, yeah. So you can sit a little bit higher. Yes, and have support. Have your knees at the level of your hips. And now if you can sit a little bit more forward, so you can now take your sitting bones, your buttocks backward. Great. So you feel comfy here? Yeah, this is good. Perfect. So first we are going to align our spine. So really it's important not for your knees to be downward, because if this is the case, your belly is going to be thrown forward and on your pelvic floor, and you are going to feel that in your lower back. So chin a little bit in, top of that up, and imagine you have a wall behind you, you want to push this wall. So push a little bit this wall. Great. And now we are going to release your arms down. Lift your shoulders up to your ears. And then imagine you want to roll them backward and down, and you don't want to touch an imaginary wall here when you are lowering your shoulders. So you don't want your shoulders to move forward. Great. So now you can place your palms on your knees. Relax completely your jaws and your shoulders. Yeah, you can even smile. We are going to exhale through the mouth, because exhaling through the mouth will allow more exhalation. So release your jaws. It's not like exhaling through a straw, like that. You're releasing, okay? So exhale, deep exhalation through your mouth, and release your belly to the inhalation. Try to deepen your exhalation. Don't be afraid, and exhaling more and more and more. Chin slightly in. Yeah, take your shoulders maybe a little bit forward. So, you know what? Place your palms down for a moment. I want you to engage your pelvic floor muscle, like to retain a knee. Exhale to the mouth, push the top of your head up and your sitting bones into the pillow, okay? Then release to your inhalation. You can again place your palms here if it's better for you. So try to exhale, deep and long exhalation, exactly. Then release your belly to the inhalation. Don't inflate, just what's coming in. If you can, you engage your pelvic floor muscle previously to the exhalation, like to retain a knee, then release this contraction. Don't hold it, yes? It's just the starter of our exhalation. So a little bit more, few breaths. Exhale, deep and long exhalation, push the sky Yes, and push the backward. When you inhale, try to widen your nostril, so it will be a more wide inhalation. Don't try to inflate on here. Exhale, deep and long exhalation through your mouth. Release your belly, just what's coming in. Engage a little bit, exhale, deep exhalation. So now I see your belly is really moving. Great. Now I want to ask you if you can interlace your fingers and place your palms on top of your head. Right, release your shoulders down. Take your shoulders a little bit forward from your hips. Great job. Chin slightly in. Engage your pelvic floor muscle. Exhale and try to straighten your arms up. Straighten your arms up. With your exhalation, try to keep your shoulders down. Then release your palms to the head. Inhale. Exhale as I'm coming up. So we're helping the diaphragm to move up, to stretch up, and release down to the inhalation. Exhale. You can first engage or not. You choose. Release. Inhale. Engage, try to engage. Exhale, deep exhalation. Do you feel a difference if you're engaging or not? Previously to the, yeah, it's more deep, yes? Release your palms down. Inhale, last one. Long, 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 deep exhalation. See how much space you are creating here. Perfect job. Release your arms down. And now you can release your arms to the side. We are going to place your fingertips behind, here, behind the buttocks. And your fingertips, the thumbs are close to your buttocks, okay? So you are in external rotation here. Chin slightly in. So we are going to, you can place maybe your hands on the pillow so your elbows keep bended. Yes. Okay. Again, chin slightly in, release your jaws, smile. Great. You have a perfect smile, so really, it's helping me. Okay, so now engage your pelvic floor muscle. Exhale. Feel that you want to bring your shoulders closer, then your shoulder blades, then your elbows. Imagine that at the strap, the tie of your bra, you have a bar, and you are like in the high jumping, and you want to pass over this bar in each exhalation. So exhale again. When on your next exhalation, really try that you want to go over this bar jumping. Yes, exactly. You want to have the strap of your bra crossing. Okay? Inhale. Yes, it's a little bit strong and working the upper back. Exhale. Exhale. To the most. Chin slightly in. Few more breaths. Long and deep, 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 deep exhalation. Perfect job. Release your shoulders. It's a hard work behind the shoulders. Feel that you're in, you know, the high jump. You want to really open your chest up, but the chin is like double chin. A little bit double chin. I am asking too much. One more. Try to start from exhaling and not from inhaling. So engage. Exhale, deep exhalation. Deep exhalation. And release, inhale, last one. Engage, exhale, great. And now we're doing counter posture. So you release your arms, you worked a lot there, and you just want to hug from outside your shoulders. Your elbows are just touching here. Your elbows are a little bit up. We're going to have the sleeping eagle. So lower your shoulders, great. And then when you exhale to the mouth, your shoulder blades are moving up and forward, sliding forward. Yes. So you feel the work here, yes? And your upper back, it's rounded now. And then you can return with your shoulders to the movements, yes? And again, exhale. Maybe because you are in your third trimester, it's less, you are feeling less comfort in this one. But it's good also to have a little bit of movement here. Of course, if you don't feel good here, you don't do this one. Yes? You are feeling okay? Yes. Last one, engage, exhale. So it's only here. Great. Release down. Let's do another counter posture because I am sure you prefer this one. So again, organize yourself there. So engage, exhale. Really think about keeping your chin in, exhaling to the mouth, and you want to have this high jump passing over the bar, lifting your chest up, release a little bit here. Don't have tension in your lower back, okay? Release your inhalation, of course. And again, engage, exhale, deep exhalation, last one, perfect. And release down. Great. So now we are going to, maybe she's moving? She has space to move, that's why.
I hope that she's going to go down.
Maybe, hopefully. Okay, so if you can, very gently turn in front of the camera now. It will be like, and sit again. So manage your pillow, you know, with those micro beats, so it's a little bit higher here, a little bit. Not too much, because we want to have, you know, the knees and the line, yeah. And just pay attention really to have support for your legs. It's really important. Fine, yeah, take your time to find your posture. You feel good?
Yeah.
Yeah? So let's have, again, let's try to lengthen our spine. So you can place your palms on the pillow or fingertips, to the side of the body. If it's, you can place them here if you want. I want you to engage your pelvic floor muscle. Exhale, push the sky, and at the same time you are pushing down your sitting bones. Yes? Then release your belly to the inhalation. Keep your posture. Engage, exhale. Long and deep exhalation. Push my finger up and my finger backward. Yes. And release. So you keep your lengthened posture. And now, we're going to have a side bending or lateral inflection. So we want to open first a right side, yes? Because I think most of the time the uterus is more on the right side. So we want to open the rib cage. So I will ask you to take your arms a little bit in the front, your right arm, and just lift it like that up. Yes, great. Lower your shoulders, so know your shoulder is exactly where we want to be. And move a little bit your body weight to the right, a little bit to the right. Keep your sitting bones, both of them down. And place your left palm on your rib cage very gently. We want to help the rib cage to move up like a crescent of moon. Okay? So as you exhale to the mouth, yeah, exactly. So you feel you are opening here. Release your shoulders down. This one also too. Release the tension here. And here you want to turn your head, chin slightly in, keeping a long neck. Pay attention to your cervicals. And you breathe in this side and out here. Okay? So have this breath coming. Don't try to inflate, just what's coming in. Chin slightly in, yes, like you are looking at your armpit, okay? And yes, a little bit more. So imagine you are really breathing this side and exhaling to this side. And each exhalation, try to go up a little bit more. So both of the sides are coming up. When you feel you need to rest and go down, so rest and go down. Yeah, release this one, exactly. One more breath maybe, and we are going to do the other side. So release slowly down. Do you feel any different?
Yeah. I feel it a lot here. It feels really nice.
Yeah, do you feel like it's more open on your right side?
Yeah,
yes?
Absolutely.
It's so I think she's happy there.
Yeah.
She is happy.
Moved down, because she's usually right up here in my rib. Now her head's come down.
This is amazing. So you did space for her. I have space. I can move.
Yeah.
Take the opportunity to move before my mommy is going to collapse again.
Yeah.
Okay, let's do the other side the same way. Because it's really important also to have both of the side. But so I want you to, instead of lifting your arms from the side, just taking your arms like that. So it's more for your shoulder. It's like, let's do it again, just from here and up. Yes. So you see the position of your shoulder is great. And now, send a little bit your weight to the left. Release your shoulders down, right palm on the rib cage. Pay attention, of course, gently, and begin to really try to move yourself up. Yeah, release your shoulders down, turn your head, chin slightly in, like we are looking at your armpit from far away. And yes, and breathe. So exhale to the mouth. Feel your exhalation is coming on your right side and you inhale on the left one. Okay? Imagine you have a wall behind you. I am asking too much. Okay, so you protect your lower back. No pinch in the sacroiliac, nothing here. Just release your shoulders down. Great. A little bit more if you feel comfy there. So exhale. Exhale on your right side. Inhale on the left one. One more, and then you can release down. Chin, just here. Yeah. Okay. So you can release slowly down. Take a moment to absorb your feelings. Feeling good? Yeah. Yes? Perfect. So I think we make space from here. This is important to free your stomach. Yeah. And here on the side, we open the rib cage so the baby can move, and it's also feeling maybe better for you. Yeah. So let's continue. We are going to move to the all-four posture. So move very slowly. Take your time. I'm going to take the pillow out for the moment. So we're going, to go to a child pose first. So you, of course, you are making space for your stomach. Some women doesn't feel good there. So if you don't feel good in each position, never mind which one, don't stay there, move. Your body knows when you need to move. Okay, from here, so if you're okay here, this is good. You can have a breath. You can also have this pillow under your belly if you want. It's good to have some breath here. Maybe open your arms shoulder wide apart. Great. Yes, you can have your forehead. You can place a pillow under your forehead. A few breaths are here to have a good massage of your stomach to help the transit. That sometimes with the pregnancy, it's like a little bit lazy. And here we're going to move up now to our all four. So I want you to glue your palms to the mat. Lift your head a little bit so your chin is active, your neck is active, chin slightly in, and your palms are forward. You're keeping contact with buttocks with your heels, but you want to keep your shoulders far from your ears. Engage your pelvic floor muscle, and as you exhale, just lift your elbows from the mat. Great. Engage your pelvic floor muscle. As you exhale, you are pulling yourself through your arms that stay completely straight. Move up. Yes, so the buttocks is really passive into the action. You want to keep, yeah. So here what happened, you move a little bit too much. Stay there for a moment. Close a little bit your legs, of course. We are going to stay here for a moment to see what's going on, or is a breath here, yeah, in a more classic posture. So exhale to the mouth. And relax your belly to the inhalation. So I don't see a lot of movement to your stomach. But if now I am taking your buttocks backward, and I want to ask you to press the mat with your palms, to pay attention to your, to turn your inner elbow looking to each other. Just looking to each other, stretch your arms, pay attention because we are very flexible during the pregnancy. Buttocks a little bit backward. And now, please, maybe take your palms a little bit backward too. No, in my direction, a little bit, not too much. Yes, just a few millimeters. There. Buttocks backward, more. Engage, push my finger. Yes, keep your long neck, perfect, like double chin, but relax your jaws. Engage your pelvic floor muscle without rounding your back. And exhale, it's scooping your tailbone in, and exhale, deep and long exhalation. And then release your belly to the inhalation. Yes. Engage. Exhale, long and deep exhalation. You see what's happening there? Your belly is disappearing. Release your belly to the inhalation. Try to engage, so you're scooping the tailbone in, but you are not rounding your back. Perfect. Press the mat with your palms. Press with your legs. Release to the inhalation. You can do it 2 more breaths. Yes, great. Then release. You see how much movement do you have here, because you have space for breathing, because your spine is lantern, really lantern here. Great job. So now, on your next exhalation, you can move backward to your child pose, just to rest for a moment. You can stay high if you want. This is okay too. Okay, so I'm going to move again to our all four. So send your palms forward. You can stay high with your bust. Yes, you really to stick when you are coming up like a turtle sticking his head off of the shell. Really like that. Okay, so the movement is into your shoulder blades. So engage, exhale, and again move up through your arms. They stay completely straight here. You can do it very slowly and stop the moment you feel that you finish the pulling action. Because after that, this is a pushing action. So we stay here. Close your knees a little bit more. So you are confined to the posture. Stay here. Engage, exhale again. Push the mat with your palms and your legs. Don't run your back. You are pushing with your legs and your palms, not rounding your back. Inhale, relax your stomach. Engage, exhale. And now we are going to lower your left elbow to the mat. Great. And push with that so you don't collapse. And try to walk with your right fingertips forward like a spider. Keep your neck long. And now this spider is moving to the right side. So move to the left side. Excuse me. Yes, exactly. Pay attention not to move forward with your... Yes. So you want to feel that. And you don't want to collapse down. Now you're going to turn your head in my direction, chin slightly in. Yes, like that. So you are looking at your armpits. Release your jaws and breathe. So you can exhale to the mouth, feeling this lengthening here. So it's good also for your back, for your lower back, and also to make space. You feel that? You feel okay there? Great. One more breath, maybe. Exhale, deep exhalation. Great. You feel it's nice here, yeah, and all this the side. And when you want, you come back as you came. So you take your palm to the side and then in front of your left palm. Yeah, you can have a spider. And then up, yes, so we return exactly to the same posture, exactly. So engage, deep exhalation, pressing with your strong pillars the mat, keeping your back completely straight. And now you can lower your other arm, your right one, and work with your left. Yeah, and you're working to the side. Yes, exactly. You can stand your fingertips if you want. You can be on your palms. It's depending on you, on your shoulders. Keep your, yes. And then turning, keeping your long neck, chin slightly in, pushing. No, this is the wall is here. And breathe. So release your belly to the inhalation, then exhale, long and deep exhalation through the mouth. Yeah, I know in yoga you're regular to breathe only through your nostril. But here, when we want to have movement of your diaphragm, and really this is good to, you can exhale more through the mouth. It's bigger than the nostril. So that's why, okay? Release, one more breath. I see your belly is moving so nicely here. Exhale, and come back. Come back as you can, yes, with your palm, straight your arms. Great. And you can move slowly to sit on your heels. Great job. Place your palms alongside your knees. You are feeling okay? You're feeling that?
Yeah. So much space, so much longer.
Yeah, this is exactly what's going on in this method. We're trying to modify the posture for your body. Yeah. So you know when you are breathing correctly into the posture, that means you are correctly into the posture. Yeah. The breath is a sign if you are there or not. Yeah. That's it. So if you're not, okay, maybe I need to see what to do. Okay? So now we're going to lie on a side. And which side you feel more comfy to lie? Because sometimes...
either is fine for me.
Yeah, on your left side, most of the moms prefer to go on the left side. So you are moving very gently to your left side. I'm going to, and if you can straight your, I'm going to come from here we are going to place the pillow between your palm and your head. So just manage that how you want. Yeah, so slide really slowly on your side. Yes, you feel good there? Yeah. Maybe I will take the pillow a little bit more here. So arrange the size you need for your head. And now we are going to place the upper leg and the pillow, okay? Yeah. You can, yeah, it can be, yes, I prefer it to be like, okay. You know what, I want your foot not to be into the air. So maybe, yeah, like that. You feel okay like that? Yeah. I don't want you to have any effort there. The other leg, so your left one, can be straight or bended but relaxed. Yeah. Okay? So now we're going to try to make space here. You're okay with that? It's not too high? You're sure? I think maybe this is too high. Yeah. Oh, I think this is really better because now you are. Yeah, I want you to keep space here. Also, this is really important. Great. So you are on your side. You feel okay? Yes? Great. Maybe I want to higher this one. Okay. Now I want to place your palm like that, like you are looking at your watch. Okay. Stay on your side. And yes, this is better. We want to align approximately both of our hip joints. Engage and exhale through the mouth and push on this palm like you want to roll on your back, but you are not really rolling on your back. I think I need to put another pillow here. So I'm going to use what we have to just have your, keep your head down because when you are lifting your head like that, you are doing some bad effort. So, okay, I organize with what I have. Okay, so we are here on the side, okay? You engage, so tailbone is scooped in, you exhale, like you are pushing with your palm, like you want first to roll on your back, but you are not, okay? So release, not the posture, only your stomach to the inhalation. And again, engage, exhale. We're going to try to make space here. Perfect. And now if you can, try to, on your next exhalation, try to open your elbow to the side. Yes. So it's more opening here. You feel? Release, inhale. Don't collapse when you release. Engage, exhale. Really try to open here. One more breath like that. Yes. And now if you can, release this palm and send your arm in my direction. Yes. Imagine I am a wall and you want to push against this wall. This palm also can be on the wall. It can be like my knees or something. You are okay with that? Yeah. Yes? So engage, exhale, and pull. Oh, yeah. You feel this one? Release, inhale, don't collapse. And only when you are exhaling, you are pushing my palms. You are pushing my palm and my knee. Yes. You can also have this hand here and do with one hand. Yes. One more. Great job. Perfect. You know, when you are in good posture, you are breathing like perfectly. You don't need to have any effort into your breath. You see that? Great. So we're going to move back to our all four. So yeah, through our all four. So I'm going to release the pillow. You know what? We're going to, yes, like that. And we're going to lie now on our back. So maybe it was not a good idea to ask you. So if you are okay lying on your back, so how we are going to lie on our back? Through our side, only to the side. You exhale, you slide on your arm. Yes, great. And you take your upper knee, exhale, hold your upper knee, if you can, from here, and roll gently to your back. You can, roll very gently to your back. Okay, so now we are going to, to see, you feel okay. Because the moment you don't feel okay lying on your back, you just have to tell me. You don't have to tell me, you have to turn.
Yeah.
It's because, you know, some...
quite comfortable on my back. I know that for most people it's not.
Yeah, sometimes it's not because of the vena cava, the uterus is pressing, but the woman, she knows. It's happening, she's not breathing good, she's turning on the side. That's it, okay? We're going to have a bridge. First, we need to lengthen our spine. And generally, when you are pregnant, the lordosis is more, I mean, or to say that in more, not only apparent, it's more here. Because the ligaments, you know, they are distended and, okay. So how we are going to lengthen our spine? First, I'm going to help you here. I want you to lift your buttocks a little bit. Okay. Hold your pelvis with your thumbs up. Thumbs up. Yeah, really hug your pelvis. Exhale to the mouth and try to send your buttocks as far as you can toward your heels and the mat. Far from your shoulders. So pelvis far from the shoulder blades as far as you can. Okay? Great. You want to try to do it another time again, alone? So you lift a little bit your pelvis. You hold your pelvis. Exhale to the mouth. Send your pubic bone a little bit toward your chest and your buttocks toward, yeah. And what I see here, maybe this is not when you are not pregnant, you still have a little bit. So we are going to do something to help. Here I have this pillow. This side is more thin than this one. So we are going to place like that, okay? So just lift your buttocks a little bit with your exhalation. We are going to place that under the sacrum. And so you can do it yourself. I mean, find the better place for you to be there, okay? Let's see. I think this is maybe a little bit too more high. I want it a little bit more down because in the opposite way it's going to aggravate the lordosis. Yeah. Hold your arm again, lift your buttocks, hold your pelvis, hug it in your palms, send that as far as you can. Don't be afraid here. Great. You feel okay there? Yeah. I forgot to say that we have feet. Yeah, they were a little bit too close. I want them to be your heels under your knees, just in this line, okay? And of course, hip wide apart or a little bit more if it's needed. Place now your palms behind your head. Avoid lifting your head as you just did because it's making pressure. Oh, and you are speaking too much. Chin slightly in. And just you want to lengthen your neck gently into your palms so you are lifting just millimeters from the mat. Release your jaws and then release your palms from behind like you are, yes. Arms up to the sky, yes. Release your shoulders down. Externally rotate your arms. Yeah, all your arms and lower them down close to your body because you want to go to the bridge pose. You're okay with the bridge? So now you can turn your palms in but keep your shoulders like that, like we came, yeah. You feel okay there? So I want you to engage your pelvic floor muscle. Exhale, press into your feet, ground your feet to the mat, and move very slowly up. Scoop your tailbone in. Try to send your pubis up. Yes. Keep your knees, send your knees forward. Keep your feet parallel. Yes. Great. And each exhalation, try to scoop your tailbone in and go a little bit, I mean, as far as you are able to do that, yes? Not more than that. Yes. And inhale, engage, exhale. We are having good stretch, and it's good to strengthen your legs when you are pregnant. If you can, on your next exhalation, you are going to send your arms backward and just make that with your palms. Yeah. So you can press against the wall or have here. Engage, exhale, lift your toes, stay just on your heels, you really stick your heels into the mat and move very, very slowly back. So you want to touch, the last part is touching the sacrum. Then release your arms down, inhale. Next time we are going to do that, when you are coming down, try to go to the end of your exhalation and to return your breath when you are coming down. It's possible? It's just for a few seconds, of course, no more than that. So engage, exhale, scoop your tailbone in, move very slowly and consciously up. Pubic bone up a little bit, scoop your tailbone in, great. Send your knees forward, root your feet to the mat, keep them parallel, yes. And when you feel ready, on your next exhalation, or another one, send your arms backward, ground them to the mat. If it's not able, you're not able, you can have a pillow there. And then inhale, And your next exhalation, really go to the end of your exhalation. Keep your chin in. Yes. I don't see almost any belly here. Come back with your palms. And release the inhale. You feel okay? And you feel your back is good, yeah? You don't feel you need any compensation with your back. Compensation is on your way down. It's possible to have another one? Great. So the last one. Really, when you are with your arms backward, exhale to the most. Take your time. Exhale. Really try to empty your lungs. You're not really emptying them. We know that, but try to. Then return your breath on your way down. Okay? Engage. Exhale. Long and deep exhalation through the mouth. Moving up very slowly, keeping your knees and your knees. Grow your big toe and your little toe. Don't move on your outer side of your feet. And when you feel ready, whenever you want, you are sending your arms backward. Ground them to the mat. Inhale. Then exhale, long and deep exhalation. Return your breath on your way down. Great. Release your arms. Yeah, I think maybe the pillow has to be a little bit more up. It's a little bit, I feel, I don't know, I think you are okay there, yes? And now I want you to, we're taking this opportunity to see how we can turn on our bed when we need that. So place your palms on the mat, because sometimes you don't feel good, you want to turn. But if you are turning on the side like a regular situation, you can have this pain here in the middle of your both side of your pubic bone, the symphysis pubic. So we need to be careful with that, not to have this sharp pain. So it's okay for you to turn on this side? Great. So as you exhale through the mouth, you're going to ground your left foot into the mat, leave the right one, yes, so very gently. Now we are going to place this foot to glue it, yes, here. To use this arm, turn it in, to turn on a block. So you can have your other hand on the side, yes. And when you exhale, move very slowly like it's a block. You're moving together, yes? So you don't have any movement into, you feel? You're okay there? Yeah. And then I want you to move slowly to your all four. So it's better when you are pregnant to move up to your all four. Find your way to your all four with your palms, yes. And from your all four, you are sitting again. You can sit in front of with this one. Yeah, manage that for a moment. So find your way. Yeah, always pay attention to have your feet. It's good to sit like that also if you are not pregnant. I mean, this is really comfy to support for the hips, to support your knees. Lengthen your spine, as we did before. So engage, exhale, and sitting bones down, top of the head up, release those, smile. Great. And then I want to thank you. How you are feeling okay?
Yeah, really good. Like space and worked, but relaxed as well. So it feels really nice.
Great. So thank you so much. And thank you for your time. And hoping to see you soon. If you have any question, you can place them into the comments. See you soon. Thank you. Have a great day. And thank you, Sophia.